Dr. Matthew Crowley is here from Duke University Medical Center and Durham VA. Thank you for joining me.
Thank you for having me, Dina.
I know that there's been a lot of scrutiny about delivery of health care to veterans, but in the area of diabetes care, really something to celebrate. Can you talk about that a little?
Yeah, absolutely. I should start by pointing out that a lot of the recent controversies with at VA have related to the issue of access to care with returning influx of veterans as opposed to quality of care. And the VA has always been, over the past 15 to 20 years, been lauded for the quality of the care it provides. One of the areas VA has been particularly innovative is in developing telemedicine infrastructure, and infrastructure for novel ways to deliver medical care. Germane to this project that I'm going to tell you about, the VA has developed telemedicine capabilities and capacity at virtually every center nationwide. What we've tried to do with this project is something new, which is to tap into that existing infrastructure to deliver an innovative diabetes intervention, specifically for patients who have not responded to clinic-based care over the years.
And have you seen that technology make some marked improvements for their health, especially in terms of caring for their diabetes?
Absolutely. We, in our Advanced Comprehensive Diabetes Care Project, which I'll be presenting at an oral talk tomorrow, we found that we were able to lower hemoglobin A1C by 1% and up to 2% in patients who engage particularly well in a population of veterans who had persistently poor diabetes control despite standard care over time.
Well, those are some great numbers. Given that, is that something that you see maybe translating into the general public?
Well, I think we have a couple tasks on our hands. So one of the innovative parts of this intervention is that we designed it specifically in a way so that it would be scalable within VA. So I think our first step is to take what we've done in this pilot setting and ramp it up throughout VA. As I said, we are tapping into existing infrastructure that is in place at every VA center nationwide, so we have a real natural avenue to disseminate it throughout VA. Once we've achieved that, and kind of concurrent with achieving that, we're looking to take this approach outside the VA as well. So, for example, we have a pilot project that we're working on at Duke University, which is taking the same approach, combining telemonitoring, medication management, self-management, behavioral support, and depression management for patients with persistent poor diabetes control, and putting that in place using a more Duke-specific approach. That should have broader applicability outside VA.
Did you talk to the patients about why? What is it about the technology and the telemedicine that makes it more easy to follow the guidelines of their health care?
We have talked about that, and that both as we're developing this approach and now as we're looking back and seeing how things worked, what we could improve on in the future. We definitely have talked to a number of patients in great detail about that question. I think patients perceive that using telemedicine enables them to have more frequent contact with the medical system, rather than having a clinic appointment every 3 months and having essentially zero contact with your providers in the interim. This enables patients to really be in touch with their medical care for their diabetes on a frequent basis, every 2 weeks in this case, and even more frequently at times, which helps patients, which supports patients in developing healthy habits and sticking to the very complex regimen of self-management behaviors they have to maintain.
I think it ramps up that accountability by knowing they'll have that consistent contact with
Absolutely.
their physicians or nurse practitioners.
Yeah, that's a great point, Dina. You know, one of the things we observe in clinic-based diabetes care is that patients will often come in with reams of blood sugar data that they've collected over the course of 3 months. And it's always struck me that they've been sitting on this data for a 3-month period. It's just been sitting there doing nothing, and patients haven't had the opportunity to translate that into improvements in their care. With this telemedicine-based approaches, what we're able to do is use that data on a continuous basis to adjust medications and offer feedback to patients. And that does build accountability. I love that word that you used, because patients know their data is going to be used. It makes them more inclined to want to collect it.
Well, it's a great idea to improve the patient health care and also the physician satisfaction. Dr. Crowley, thank you so much.
Thank you, Dina. Appreciate it.